This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com. Welcome to the SOM podcast. I'm Steve Randall, and in this episode, with much discussion ongoing following the Mayfield Review, we're looking back at an influential piece of research from 2006. Is work good for your health and well-being?
Hi, I'm Janet O'Neill. I'm an occupational health nurse specialist. I've been in occupational health for about 25 years now. I'm deputy head of the National School of Occupational Health, and I'm particularly interested in this conversation because the work good for your health and well-being meant a lot to me when it came out in 2006.
My name is Kim Burton. I'm a freelance occupational health researcher, formerly a Professor of Occupational Health Research at the University of Huddersfield, and I've perhaps been around the work and health space for a little bit too long, but I'm still enjoying it.
Fantastic. Well, welcome both of you to the podcast. Regular listeners will have heard both of you on various episodes before. Kim, how well has the evidence that work is good for health been applied in practice since the report?
I'm going to be really brutal and honest and say not very well. I'm somewhere lost the what of the delivery of occupational health and related interventions. We've concentrated a lot on the how it's delivered, in other words, the process of delivery. But we seem to have lost our grasp of the what that's being delivered. The content of what's being delivered doesn't seem to be implemented in the right way. And there's a load of reasons for that, which we may pick up as the conversation goes along.
What stops employers and OH as well, do you think, from focusing on that? What is delivered rather than how?
I think it's actually a lack of appreciation of the what, of the content. And that's been an issue around the culture around work and health that we talked about back in 2006. And Dame Carol Black talked about it in her report a couple of years later. And we still haven't changed that culture around the understanding of the relationship between work and health. So perhaps it's, to some extent, a true knowledge transfer issue. We kind of know what should be done and what we should be saying and what we should be doing, but somehow that knowledge hasn't got across to where it can be actually implemented well.
Janet, what are your thoughts on that? I mean, it's obviously been a long time since the report came out. You mentioned 2006. There's been time for things to shift. Why do you think things haven't shifted quite as much as they should have done?
Well, it's a really interesting question because obviously the change that I saw from that particular report was within the conversation that occupational health had with the employee, with the person that they were speaking to, and that we felt more empowered about encouraging people to think about work as part of that recovery. So I can only think that the breakdown must be in that sort of relationship between actually, is it occupational health gives the advice and the support to the individual, but does that go any further from that when that report goes out to management? Does it have the weight or does it have the communication that's needed in order to be able to facilitate the conversations that go from there? So, and I think it's that conversation, Kim, that you feel quite strongly about, isn't it?
Absolutely. And the more I've thought about it over recent years, the thing that seems to be missing is indeed the work and health conversation. And I think that's quite a potentially really powerful tool that we've missed the impact of, really, or we've missed delivering it in an impactful way. That conversation is something that should happen at various different points. It's not just between OH and the client or the worker. It's also getting that knowledge, the report, if you like, or the return to work plan that's been developed between OH and the person, getting that across to the workplace, to the line manager in essence. And the line manager then needs to be able to have that work and health conversation with the worker who's been perhaps through an OH or a vocational rehabilitation process and to be able to understand that relationship between work and health, to enable the conversation, requires that transfer of knowledge that I was talking about earlier on, so that all the key players, the worker, the healthcare professionals, the OH professionals, and the workplace and the various people within the workplace, including HR, are having the same sort of conversations based on the same concepts, the same underlying principles. And getting to that is going to be a matter of education.
From my sort of layman's point of view, has this always been considered quite transactional? So, when things happen, when employees need the support of OH, that the employer brings that in, but it's not something that's in their culture, in their psyche on an ongoing basis. And is that changing now that we are having perhaps more of an open conversation about work and health and well-being, how that all connects together? There has been a lot more talk about that, particularly since the pandemic, of course.
Yes, there's been a lot more talk about it. I'm not sure whether that's actually resulted in wholesale action. There are certainly pockets of really good practice out there, as Charlie Mayfield identified in his report. But as for the wholesale change, I don't think that cultural change has actually happened. And part of that, I think, is that we're not all yet working to the same set of concepts, the same principles, and the basic understanding of the work-health relationship and how we can actually support people to maintain their workability from the early stages of feeling unwell at work through sickness absence if it's necessary, through job change if it's necessary. It's that sort of overall process of the relationship between work and health, which we know should be a positive one and not a negative one.
Actually, a lot of us in occupational health feel quite strongly that the first conversation around health shouldn't actually be with occupational health. It really should be with the line manager. And I know that puts a lot of pressure on the line manager, who are both people managers and task managers, but actually it can make a huge difference having that initial conversation with that person and trying to resolve, concerns around work and health or health and work there and then, before and only coming into occupational health when they need that little bit more of an expert opinion.
I think you bang on, Janet, that initial conversation is a really important one. And currently the line manager is bereft of knowledge and understanding, if you like, and isn't equipped to deal with that conversation at that stage. And it could be very powerful if the line manager was equipped in that way. And I don't know whether this is a good time, Steve, to mention the Society of Occupational Medicine training program that's being developed to address this very issue of having a double tier idea of a foundation course in work and health conversations that will be applicable to line managers, to HR and other professionals in and around the workplace, including insurance and the such like. And then perhaps a second tier, which we'll call a certificate in work and health conversations, that is a longer course that enables people to actually do more stuff rather than just have a conversation, or actually take that forward and have meaningful conversations that develop those return to work plans or stay at work plans, we can call them workability plans, I guess, based around identifying that individual's obstacles to working and finding, agreeing and coming up with solutions and putting that into a plan.
The training issue is really important, and somebody needs to be leading the conversation, don't they? That's the thing. We're all talking as individuals, whether or not we're involved in OH or not, and certainly I speak to a lot of HR people, they all talk about the importance of looking after their teams, the well-being, the health of those teams, but perhaps they're not absolutely sure who's leading that conversation. This is an opportunity for SOM and the wider OH community to take that on.
Yeah, I think it absolutely is. And the leading the conversation is really important, Steve, as you say, and getting the leaders of the conversation to start the conversation in the early stage is really important. But what's also important is that consistency of messages, consistency of culture across the whole space, the whole journey, which means that a line manager, an HR professional, an OH professional, or a GP should all be having the same sort of conversation based around the same principles, which are obviously included in the training packages we're talking about.
It's a fantastic thing that some are doing, and absolutely essential. And it's been highlighted in the CIPD recent report that came out. Their annual one, where actually more organizations are doing a lot more around well-being strategy, but only a small amount are educating their line managers. But what is giving the best outcome is actually that training for line managers. But it's still important to have the strategy, because there's no point in a line manager having a good conversation if they've got no tools to use to support that individual with. So there needs to be a framework and tools behind it.
Absolutely.
And we're all bombarded by things. I mean, I see a lot of articles in my news feed. I'll see all kinds of things about workplace well-being, and they're all coming from different sources. And I think that can be very overwhelming for somebody who's running a business, for line managers, for HR, because you think, well, where's the trusted source? And I think that's where sort of really taking the lead is crucial for SOM and for the wider OH community.
Yeah, that's a really important point, Steve. Absolutely so. I actually agree.
And I think from a well-being perspective, SOM has already put out a couple of really good guides on evidence-based well-being. And it needs to be evidence-based, because we do see organizations that go, what is my neighbor doing? But actually the makeup of their workforce is completely different to the makeup of, said other organization. And you've got to take into account the whole of where the workforce comes from, not only just what the type of work that they're doing and the risks that they're exposed to in the culture of that particular organization.
Do you think there's a need for OH professionals to be more proactive, perhaps, in getting into organizations and starting these conversations rather than being brought in when things are perhaps going wrong?
It's a tricky one, because obviously I've got an occupational health bias, a strong bias, whereas I know that there are a lot of our wellbeing practitioners now that have got a strong evidence base in the work that they do as well. But I do think that because occupational health has the wider view of an organization, they understand the risks, the job demands, and of course, because occupational health is now very multidisciplinary, I do think that we are well placed to support organizations with building their sort of well-being and their workforce strategy. I think it would be great if, especially after the Charlie Mayfield review, if more organizations looked towards occupational health to be that sort of expert guide.
There's something earlier than OH that can be done, whether it be by line managers or a different service, with perhaps non-health professionals being able to deliver a useful and helpful work and health conversation at an early stage that help to maintain workability. And if that simple approach doesn't work as well as perhaps is hoped for, then move on to the next stage, which could be OH. And if the in-house or bought-in OH service can't cope, then escalate that out to a formal vocational rehabilitation approach, or perhaps to further healthcare.
I think that it's absolutely correct what you're saying, Kim, and that organizations' workplace health should be looked at internally first, and have a look at what's happening internally and what could be put in place before going out to anybody else. But I suppose it's like any service, it's doing your homework on what's right for your organization. If you've got a lot of risks in your organization, then you may very well be looking at occupational health, because we want it to be preventative, but ideally, and I think this is the Charlie Mayfield report is really focused on organizations looking internally first and seeing what's right for them, and then looking out and seeing who are the experts that can support them.
Yeah, you've just picked up on something that's really important, Janet. We've been talking about maintaining workability, but actually there's something also about the content of the job itself. It's good jobs that are good for people. Way back, which is what we said back in 2006, it's not just work is good for us, it's actually good work.
We can talk about training and how that can help to raise awareness, how it can educate, but how do we then ensure that training leads to real behavior change and not just that awareness? How can we stop it becoming a tick box exercise where line managers are given this training, something's ticked off to say, yep, done the training, but that they then implement it in everything that they do?
I think the answer to that is twofold. One is the type of training that's being delivered or given, and that's something we've been thinking about whilst developing the SOM approach. That the training has to encourage that cultural shift, which then, if it's widely accepted and widely distributed, changing the cultural shift will change expectations, and the worker will then expect the right sort of conversation to take place. The line manager will expect the worker to accept the conversation, and then the line manager will expect OH to be following the same sort of route. So by changing expectations, we can hopefully change behavior. It's not that simple, of course.
There are other ways that you can assess a success, and one of those is by gathering data. So looking at your retention rates, having a starting place. Stress risk assessments are excellent, or employee surveys where the management standards from the HSC are built into those, and having a sort of a set of parameters that you're then able to assess on a regular basis going forward, of which retention will be one of them, being able to, how many people are supported in the workplace, sickness absence, presenteeism. So there's a lot of data that actually can come out that can actually assess whether there is that change. And that's not just quantitative data, but we can also look at sort of qualitative data, how managers are feeling confident and their reflection in maybe how they've managed so-and-so who's got a cancer diagnosis, or so-and-so who has anxiety and depression, and how they've managed to support them and remain in the workforce. So I think there's a lot of metrics, and it does take a bit of planning, but it absolutely can be assessed in time, the success of a program like that.
Yeah, I think the message there, you're absolutely right, Jen, and the message there is that this isn't going to be a sudden change. It's going to be a gradual shift to change culture, just like changing any sort of culture has got to be a gradual process, but hopefully once started can gather momentum.
Yeah.
Well, I think we've just scratched the surface of this huge topic, but I think that's a good place to end this conversation for now. So Janet, Kim, thank you very much. This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.